welcome to our Nuvior weekly webinars with our new academy. Nuvior is a medical innovation company that is a fast-growing company, and we deliver the newest in technology and devices to North America. We are passionate about our work, and our team is passionate about supporting you and helping you grow and sustain your business. Now, here at Nuvior, we are very honored to represent some of the most amazing brands available in Canada. And we are going to be speaking about Mesoaesthetic, which is a beautiful medical grade line from Spain. And they are just the leaders when it comes to science-based technologies and treatments and products, and designed with everything in mind. Dermaceutic is a medical grade line from France. It was born from French dermatologists, and it's great to enhance and support everything you offer now in the medical field for aesthetics. Aptos. Aptos is on the verge of being approved by Health Canada. And here at Nuvior, we are so proud to be the representatives of our Aptos thread lifting methods, winner of the AMWC Aesthetics Medical Award for Best Suspended Threads for their 5th year in a row. And our FEDIA high tissue PRP system. If you haven't heard about FEDIA PRP, it is just been recently approved by Health Canada. We have a fabulous package that gives you one of the most easiest and best systems to deliver you high quality and pure concentrations of PRP for your medical aesthetic needs. And at Nuvior, we want to be a one-stop shop place for you. So we offer over 50,000 different SKUs for medical supplies to support all your needs for your facility. So just check it out on our website. If you don't see something you are interested in or need some help with clarification, please reach out to the Nuvior team. We're always here to support. I'm Pina Lee, clinical lead education, and I just love to teach. So please sit back and get excited about our topic for today. We're going to talk about the Cosmelan and Dermamlen journey. This is breaking it down. So we're going to break it down each week for the next few weeks for you, the professional, to be more empowered when it comes to your Cosmelan and Dermamlen patients. We're having a problem with the audio with one of our viewers. I'm sorry if you can't hear me. Just check that your speakers and your system are aligned, and reach out to our Nuvior team, and maybe they can help you. So to me, the most crucial point of any successful treatment begins with that consultation. And it doesn't matter whether it's Cosmelan, Dermamlen, or any other treatment you offer. That consultation is a critical point in the success of turnout. So today we're going to review what are the concerns that we're treating. We're going to understand, I'm just going to touch briefly on Cosmelan and Dermamlen so you have a better understanding of what we're talking about today. We're going to talk about the ideal client for the Cosmelan journey, and we're going to break down that. Yeah, subtitles are in French. And we're going to break down the components of your Cosmelan treatment protocol for your consultation. and the documents that are required for a successful consultation. So let's discuss what you can treat with Cosmelan and Dermamlen. So I'm not going to get into too much of the science, but if you do need some more information about it, we can provide it with you. But just so you know, we are not medical doctors, so we aren't going to diagnose the skin. That's why you have your medical director and you have the advice from the professionals on the medical team that your client frequents. So we can treat our solar damage. So whether it's called age spots or liver spots or the solar freckling that we get that darkens in the sun, solar damage in the epidermis is where you're going to see it, and it is going to appear where that sun is exposed to that direct sunlight without protection. As we get older, as we fail to cover our skin and protect it, that damage is accumulative, which means any damage that you did to your skin throughout your life is going to collect, and it's going to display itself later in life in the form of hyperpigmentation. Our post-inflammatory hyperpigmentation, that occurs post-trauma. So it's your secondary lesion of sort after a traumatic experience, such as acne, or from treatments, whether it's waxing or a stronger device, and there is pigmentation caused from that reaction of the skin when it does get inflamed and the blood rushes to the area and it causes inflammation, which causes your pigmentation. Cosmelan and Dermamlen can also treat your ephelides, better known as freckles. Now, freckles are something that a lot of us are born with, and they do intensify in the sun. So yes, and I always say, I don't know why people want to get rid of them, but I think they're cute. But yes, you can treat those ephelides as well. And one of the most challenging are hormonal-based hyperpigmentation, melasma. Now, melasma needs to be diagnosed by your medical team. You'll need to understand with melasma, it is a pigmentation that isn't due to that solar damage. It is caused internally by hormones. So when you talk about melasma, you need to understand it is a chronic hyperpigmentation that can be managed and suppressed, but you'll never cure it until those hormones are doing what they need to do. So melasma can be successfully managed and suppressed with our Cosmelan and Dermamlen. So what is Cosmelan? So just a brief overview. It is not your traditional topical chemical peel. It's a system, a program, a method, a journey. However you title it, it is a beautiful recipe that has been tested, tried and true throughout worldwide by over 1 million clients to treat corrective and regulating actions for skins that treat your solar, your melasma, your post-inflammatory hyperpigmentation that is located in the epidermis, pardon me. So Cosmelan is your professional depigmenting treatment. It does not require a medical director, and it is going to go beyond that traditional peel. So it is going to get into the actions of that melanocyte at different levels by reducing that material it needs, those raw materials to create the melanin. It's going to reduce the overproduction and overstimulation of that tyrosine, and it's going to stop those melanosomes, those exit points, from transferring that melanin to those skin cells. So they're not going to allow that melanin to reach those points. And yes, at the surface of the skin, Cosmelan is going to provide that renewal, that lightening and dispersing of that existing melanin as a corrective method. But it does do both. So it is a two-pronged corrective and regulating action. So this is what makes it such a unique and a very well-rounded or all-rounded treatment. And as a client who owns a facility for yourself, take this particular side, put it in your verbiage so your client can understand how truly amazing and how different the Cosmelan process is compared to the traditional peels and treatments they are accustomed to. So it's going to regulate, it's going to stop that delivery and correct for all skin types. So that is what it looks like. You have your one in office treatment, and then the home protocol is part of the process. It's not just products that support your outcome. It creates your outcome. With that first phase, we give you the tools to determine how to apply that product. So in that first phase, you're going to look at the skin type, whether dry, normal, or combination, or an oily skin. You're going to look at that phototype, whether they are a light 1-2 in the Fitzpatrick scale or in the darker 5-6. So depending on their skin type and their skin color, that will determine the exposure time of the Cosmelan mask. This is enough for one treatment. Your client will use that entire jar in their session. So your consultation is going to be extremely important because this is where your time is taken for that first session, or in lieu of that long first session, because the application is very quick and then you send the client home. So really use that client consultation to set the stage. So when you're in clinic, the client is prepared, you're prepared, you get the message on, and they can go home. Once they have had that initial treatment, they're going to wear it home, remove it. Then they're going to use that step-down protocol for their home treatments. Now, I do want you to be aware of the powerful and amazing ingredients that Cosmelan uses to treat the pigmentation. We have some heavy hitters here with your azulene, your kojic, your arbutin. We even have niacinamide. It's got your phytic and salicylic. So you can see these are very active, and with mesoaesthetics formulations, they're very highly concentrated. The same ingredients, and this is so important to understand, the same ingredients that we are using in our in-office treatment are also the same ingredients in their home treatment. However, those concentrations are at a lower dosage, allowing that client to use these beautiful acids on a regular basis daily for continuing that depigmentation program. So in office is when we have our intense depigmentation, followed by our step down protocol. What does that entail? It entails 3 home phases: phase 1, phase 2, and 3. So you've got 3 phases where they're going to step down with the use of their actives. In phase 1, they will use those concentrated actives, which are at a lower concentration, for that daily use and durability 3 times a day. So 1 month for 3 times a day. The next 2 months will be twice a day. So we're stepping down, removing that midday application. And then we're going to go into that third phase at home, which is phase 4, with a 3-month use of those actives once a day. So 1, 2, 3, 3, 2, 1 for your actives. Very simple. It's in their boxes for them. Of course, you will send them home with a written instruction sheet that we can help you with. So that's your Cosmelan. Now, our Dermamlen is also for hyperpigmentation. However, this is a medical depigmentating method. Dermamlen uses the latest development. We have reformulated it in 2021. So now it is designed to be faster acting, more tolerable, and yet more potent. So this is designed for that dermal hyperpigmentation, for that, whether it is induced by hormones with melasma or post-inflammatory hyperpigmentation. This system is going to treat visible deep pigmentation, but it's also going to regulate and stop the pathways. So preventing those pathways that are induced from inflammation, vascular pathways, and those hormonal pathways that help to stimulate that melanogenesis process in the skin. Not only it is a beautiful treatment for depigmenting the dermal area of the skin, but it is also a powerful anti-aging tool. So it's got those amazing patents that you will not find anywhere else with our melaphenone, our new molecules they created, and our syn pigment target, which is a patent complex that is just blown how we deal with that pigmentation. So your melaphenone is so powerful on its own. It can just reduce that trisomies activity by 56%. And that new target, that Signa pigment target, which takes your retinol, your ferulic acid, and your diazomin, takes them and makes this compilation that works 2.5 times better than any of these acids on their own. So with this kind of formulation, add in the other beautiful acids, and Dermamlen is such a unique medical treatment for that dermal bounce back pigmentation. So you can see these items are a beautiful cocktail for anti-aging as well. In office, they're going to be the same procedure regardless of the skin type or phototype. So all clients will receive the mask in cream form, followed by the ion mask, and wear the mask home for 4 hours, upon which time they will remove the mask and in a few days continue again with that home treatment protocol. For this, it is a 4-month protocol. And the patient will use their actives every morning and every night. So as you can see with this formula, it's much easier to follow, and the results they're going to get is going to be not only a reduction in that overall pigmentation by 57%, but it's going to reduce wrinkles. An anti-aging treatment with the reduction of wrinkles by 32%. So an excellent tool for you to use with your clients. So to recap, the two treatments that we are going to be focusing on for our consultation, the Cosmelan is a non-aggressive professional aesthetic treatment. It does consist of your wear home mask that will be worn for 8 to 12 hours. It does have a home protocol as part of that depigmenting treatment that involves your step down in continuous depigmentation, regulating that depigmentation, and controlling that pigmentation for 6 months. It is beautiful for treating your solar, your freckles, your mild and superficial melasma, and your post-inflammatory hyperpigmentation at a minimal cost. Your dermamelan, to recap, is that intensive medical depigmentation treatment and a very powerful anti-aging treatment. All clients or patients will wear this mask home for a 4-hour exposure time and will follow a 4-month home protocol that they use their actives twice a day. So no more step down treatment. It is best for that dermal and severe cases of hyperpigmentation from melasma or your PIH. Now with this one, because it is more intense and it is a medical treatment, you will find that there may be an increased risk of those local skin reactions during the process. Now, of course, we all have that information now clear in our head. So we're going to turn our attention to the ideal client for this program. Now, when you are treating hyperpigmentation, especially in the darker skins, I always side on the side of caution and always recommend checking with medical professionals for diagnosis. Ensure that you understand that you want to go low and slow. You don't have a magic wand, and we do have to play with the skin in real time and get that client to understand that this is a journey and we work together. Now, your ideal candidate of a Cosmelan or dermamelan journey, this is a client not just fresh out of the streets and walks in and says, I want something for pigmentation and I've never used anything for before. Cosmelan and dermamelan are for that client or patient that has undergone their medical aesthetic procedures that involve that skin rejuvenation process. What does that mean? That your patient, their skin has been through that process where the skin experiences tightness, redness, stinging, and burning, that erythema and drying and cracking, and the shedding and desquamation of the skin. So why do I say that? Because this is an intense treatment. You saw the ingredients in these formulations. So your client will have the chances of experience that themselves. So they know what to expect. They've been there before. They are seasoned. Their skin must be healthy and intact. In school many years ago, for some of us, we learned that as a skincare professional, we need to prioritize how we treat the skin by what this client skin has presenting us. So we take care of any trauma first, any dehydration and sensitivity. Then we move into our acne from inflamed to not inflamed. And then once we get past that and congestions, then we're dealing with those anti-aging and depigmenting concerns. So for the Cosmelan and Dermamlen journey, you want that skin to be healthy, to be hydrated with a barrier that is intact. So there's no openings of acne or scratching or picking. You want that client to have used the unique formulations within our meso-aesthetic lines. Yes, there are many fabulous lines out there. Competition is healthy. However, when you are going to be taking a journey with the Cosmelan and Dermamelan ingredients, does it not make sense to ensure that that skin has used those beautiful acids, that their skin is acclimated to the formulas and combinations of the mesoaesthetic line? So when they go to have their treatment, their skin is going to know those ingredients and be able to use them more effectively and efficiently. So this client for the Cosmelan journey will be using their mesoaesthetic products for a minimum of 2 weeks. And in another presentation, we'll go into preparing the skin for the journey. This is a journey that is suitable for all your photo skin types on your Fitzpatrick scale from type 1 to type 6. Now, again, I have to stress, when you are doing a consultation, this is the most crucial time. This is where that professional meets that client. The client decides if they can trust you and that you can do what you state you can. So to do that, you have to be prepared. Preparation for that successful consultation involves you being knowledgeable enough about what you are discussing, in this case, Cosmelan and Dermamlen, so you can explain it to other. One thing I always learned throughout my career, when you are trying to share information, it's a transfer of emotions. How you feel about that product will be transferred to your patient or client. So if you understand the differences between the Cosmelan and the Dermamelan, then you will be able to confidently discuss this with your client in the consultation. You are the expert, so you need to stay updated. And have your leaflets and your visuals at hand so you look very well prepared with your supporting information. We can provide you with both hard copies and digital material for you to use in your consultation. Ensure that your devices for your photos and your skin analyzing are ready to go. You want to make sure that your spot for taking pictures is ready, you've got your device, and you can analyze that skin. Before you go into that consultation, take a moment to read through that consultation form. Make sure that you absorb what that client has written about them so you can get your questions ready when you're face to face with the client. And make sure that you have all the documentation and the client take-homes at hand so you look like the professional and the expert on the subject at hand. And this is no truer words have been spoken, that your client consultation is your foundation, that crucial part of the treatment process. When you have that foundation, your client will trust you. and you will be able to get the information from them that you need to create a successful treatment and have beautiful outcomes. To do this, you need to build that foundation by providing an environment for that client where they're going to feel comfortable and they're going to feel support. So your consultation should never be done out in the open, but in a room where they can discuss freely with you. You need to make a friend. You need to establish a relationship of trust so that client feels that it's all about them and you are truly interested on what they need. It's so sad that I can say that there's so many professionals out there that, yes, they're so bogged down and busy that they don't even get the client's name or tell the client their name. So take those few minutes and build that foundation. Find that common ground between yourself and that client. Be active listener and develop a beautiful foundation where that client will open up to you. And that brings us to understanding the goals and the expectation of that client. We use this consultation to talk to this client about what we can offer them. So we need to gain insight into those clients' true desires, their goals, and their expectations. And we can't just get that from a piece of paper. We need to ask those questions. Give them a mirror. Give them the image of that skin analysis if you have it on a device, and talk to that client so you can really bring out their true desires on what brings them there today and how they feel that you can help them do this. Once you've accumulated all this information, you can then decide which of those treatment options are best for those clients' preferences and needs, so you can minimize that risk of dissatisfaction with their treatment. So how do we do this? We do this through a thorough analysis and by asking questions. We are doing a consultative consultation. Consultative means we have to talk. We can't just look at a picture or answer a couple of questions on the phone. We really need to look at that skin inch by inch, pull it, stretch it, look under a good light, talk to that client, have your intake forms with you so you can go through what medications they're on, what supplements they take, whether they're prescribed or over the counter, your OTCs, and even their herbals. Because some of those supplements, some of those over-the-counter drugs that we're using and that are very common in our everyday world can make us more photosensitive. So we want to ensure that the client knows that compliance of using the sunscreen or stopping certain products must be done before they come in for the journey. With allergies and intolerances, you need to be aware. For example, with Cosmelan and both Dermamlen, there's salicylic acid. So you need to know about their allergies to aspirin. You need to be the detective. Find out the who, what, wheres, and how longs that they have tried for their problem with this depigmentation. Have they tried lasers, or have they tried different kinds of agents like hydroquinone to lighten the skin? You need to understand that it's a puzzle you're piecing together, and you need all those pieces from your client to get a better picture so you make the right decision in determining which treatment to go with. Another thing that is so vital is to find out about your client's life. This is a powerful treatment, whether Cosmelan or especially with Dermamlen. This is not a treatment that you want to slap on your face and travel around the world. So find out if this client is going on holidays, when they're planning on doing their travel, so you can customize it for them. And of course, find out about their contraindications, especially when it comes to whether they wanted to get into starting a family and whether pregnant or planning on being pregnant and lactating. They're too hormonal at that point to focus their attention on depigmenting. So save it for after. And of course, as I said, you need to know are going to be arising. So you want to know how they deal with the sun. What is their routine on sunscreen? Are they going to be a client that will comply to the process of this journey? You need to understand how their day goes so you can help them with that second midday application. And of course, we do this with, again, talking and asking questions. So for example, when a client says to you, that midday application for the first month is a challenge for me, what are they going to do? So you say to them, well, I understand you don't want to take off your makeup. So rather than doing it at work, let's move that second application to right home as soon as you get home, and then bump that last application a little later that day. So for, yes, the 30 days, you might have to slightly shift your daily routine, but it will be worth it. Now, I'm just going to pause for a second as I saw there was a question. What do you say if you see someone is not going to comply? Is your question? Yes, I will talk more about that after. Basically, compliance to me is giving them enough reasons why someone needs to do something. And that's exactly what you have to do. And to do that, you need to empower them through education. So we know as women or as humans in general that we will do what we want to do for our benefit if it means getting what we want. So what am I saying? People will do what they need to do to get what they want. So it's our duty, our due diligence to empower that client with the information, to educate them. So when they have that proper knowledge, they will be able to make that well-informed decision. So educate that client about their treatment options, use that consultative approach, highlight the benefits. Say, yes, I understand you can't go tanning this month or for the duration of this journey. However, you will have dealt with your pigmentation issues, and with proper treatment and protocols to manage, you'll be able to return to everything that you want to do. So we need to explain that procedure. We need to tell them the potential risks. And I think when the client understands those potential risks, they will be more open to complying because they do want those benefits. So definitely explain that procedure. Don't make it a last minute thing before they apply the mask. Get them to understand what the procedure entails, the risk if they don't follow the protocol, and the benefits and the absolute joy that they will receive when they do follow the proper protocol. And of course, once you've educated that client, send them home with the information, talk to them about the process where they can understand, recap it with them. Ensure that you're still on the same page and that they did understand what you said. So to manage that client compliance and expectations, you want to set realistic outcomes. So first of all, to get clients to comply, you need to not overpromise, to be transparent, and to build that trust. Tell them this isn't a magic wand, but it is an amazing tool that has been used all over the world for years to manage, to eliminate, and to control hyperpigmentation in all photo skin types. So tell the client what they need to do, explain those potential results and the limitations. Review that comprehensive protocol with that client. Make sure they understand what the step down means. Go through how much of the product to use and give them the tools to help identify and manage those triggers and assure them that you're there to support them. And of course, it's repetition. Just like anything, the more you repeat, the more you check in with your client, the easier they will be able to comply and get the results that they want. And I hope that answered your question. So when we talk about the triggers, yes, we are treating, but that client also has the responsibility to help us with it. If you are showing them and doing your treatment, you're putting out that fire. But if they're going home and they're not even considering the factors that also determine how melanin is produced, then they're just throwing jet fuel on. So you want to make sure that they are being compliant when it comes to sun exposure. You don't do a Cosmelan or dermamelan journey and begin a journey and go away to a hot country where you're going to sit out in the sun. So yes, it can be done in countries all over the world, but you got to be mindful of sun exposure. Use long clothing. Use your product like your Milan 50 plus and reapply. When you're indoors, you have to protect yourself from that high intense visible light. Of course, with genetics and aging, that we can't control, but we can use our epigenetic products from the 8-element line to help with those switches so we can teach that skin to be younger. And of course, we need to consider everything that we're using. Increase our vitamins, our water intake, increase our proper choices when choosing our liquids and our food. So we have to get that client to understand we can do everything and you need to support it with your proper healthy choices. Now, another factor of the Dermamlen and Cosmelan journey is your documenting. So when it comes to documenting, we have to understand now photos are essential. So get in a routine of having an area dedicated for picture taking where your lighting is the same. You position that client the same. There's many tools that can help you with that. Use the same device to take those pictures so you have consistency. These photographs can be an excellent and powerful tool for social media, for getting compliance from other clients as well, because they can see the journeys of other people from your practice. It also is a crucial tool for yourself in the treatment process, as it provides a base point and shows the progress. It also helps with showing how that melanogenesis process works through the skin. And as it's combating it, how it's going to get darker and lighter and darker and lighter until it can regulate and combat it and maintain it. So make sure you do that initial picture before. I love to ask the clients to do an every day so they can have their own transformation, but definitely when they come in for those visits to replenish their products, when they come in for their appointments to check in, take the pictures and create your own photographic log. And with the paperwork, this is also a great tool to help with compliance because that's all in writing. Your words are being said to them in the consultation, but now they can see it and it makes it real. So allow that client some time to be able to read through and fill out those intake forms. So have them come early before their consultation. When you are discussing the treatment protocols and the benefits and those potential risks, make sure they have that paperwork that they can see and use and read. And of course, go through that consent form, review that intake form with the client because we're the professional. They are just the layperson that's answering the best of their ability. So it's up to you to use what they filled out and ask those questions to get clarification, make those notes, acknowledge what you see, and make notations in your client's file. This also allows your clinic to work better because everything any technician needs to know is now in that file for that particular client. So if someone is away or is no longer there, that client can still get beautiful treatment protocols from your existing staff. So we do have some sheets that you can use. These are very useful. It takes you through so you can get that medical history from your client. When you start asking these kind of questions, the client starts to realize, hey, this isn't just a manicure or a facial. This is something serious that I have to answer questions about. So again, with that that appropriate documentation, it gives you another tool to assist with having that client comply. So this will go through their medical history. You also, again, as I said, want to find out about their skins, what they've done in the past, and then set it with them so they understand how to use each product, when to use each product, and if necessary, how to manage those reactions. And again, we'll learn that in another one of our webinars. So in saying that, once you've done those assessments with your intake form, with your questions, with your skin analyzation, then you will sit with your client and go through that consent form. Don't just have them sign it on their own. Read each part, highlight, go back, refresh them where you talked about it in that education so they are not surprised when they do get stinging or some flaking or it's tight and it's cracking. A client that knows what's going to happen and knows what to expect is going to be more willing to go through that process and be able to be assured that you will be able to manage those skin reactions and have them have a successful journey. So going through each point, having them initial, giving them a copy. And that to me will definitely assist and help you get your client on the same page with you, get your client to understand what is involved in the Cosmelan and Dermamlen journey, and they will receive the beautiful outcome that they are looking for. So to recap, the client consultation is the foundation for your professional and patient-client relationship. It's the way that you differentiate yourself from others because everyone knows how to do that protocol, but it's your consultation that is going to make you different from everyone else, and they're going to help. It's going to help you show that client why they should be with you, because you are that informed expert. You are prepared and know what you're talking about. You've taken that step to find out their needs, their preferences, and tailor it to them. It allows you also to highlight that experience that you have and earn that client's trust. And it sets the stage for that client's journey and their experience. And like any skill, just like the protocol of applying the mask, a successful client consultation is a skill that improves as you practice and make it a step of consistent steps that you go through each and every time. So thank you, everybody. I hope that this was informative and helpful for you. As a token of appreciation for joining us in our webinar today, I would like to offer all clinics that are putting in an order to use this link right here, and you can answer a few questions about your experience at our webinar, and you will receive an email with your 5% code for your clinic order, and that's good even on your sale items. For everyone who has attended, I would like to offer you an opportunity to create your own account, whether or not you're a business owner. Create your own account as an employee of the clinic, and you too can enjoy clinic pricing, and as an employee receive 20% off your purchases of clinic pricing. So please take advantage of those great opportunities so you can try yourself the wonderful products we have to offer. On behalf of Kyla, our clinical educator in Western Canada, she's located in BC. If any facilities out in the West are looking for some more information, please reach out to Kyla. I myself am Pina Lee, and I'm here in Ontario, but I can help you anywhere that you are. So please use my number, call me, text me, or reach out by email. And if there's any questions now, I will open it up to the floor. I hope I answered your question there at what do you see if you see someone is not going to comply. Basically, you got to be transparent with your clients. And I believe in transparency and telling them that this recipe, this unique, encompassed program is designed to work. But with anything, you need to follow how it works to make it work. So be clear, be transparent, highlight the benefits for them, make it work in their schedule, or see if you can make it work in their schedule. If not, I can help you with alternatives for them. I hope that answered your question. Is there anybody else, any other questions we have today? Oh, I'm so glad that helped. And please reach out to me. And if you want a session for your team to learn how to talk to that client, or your frontline staff, how to introduce the idea of Cosmelan and Dermamlen, please, that's what I'm here for. So please reach out to me. Fantastic. So if there is no other questions, I'd like to say thank you so much for joining us with our new Academy weekly webinars. Next week, we will continue this beautiful journey on the Cosmelan and Dermamlen journey. And I invite you all to join us again next Monday, 12 p.m. Eastern Standard Time. And while you're here, don't go. I want to tell you that on Wednesday, I'm so excited because I love it when we get trained, our education right from Spain. We're going to have an opportunity to listen to one of the global educators of mesoaesthetic corporate office discussing Mesoprof solutions. So if you have not registered for that event, it will be conducting on Wednesday at 10:15 a.m. our time, Toronto time. Please visit our site or check your emails. If you don't have it, please reach out to anyone on our New Viewer team and we'll make sure we get you squared away. So this is Pina Lee saying goodbye and have a great and happy Monday. Enjoy your day.